First of all, I would like to recognize the presence of Prof. and Prof. Benedikte. But also, I would like to recognize the presence of TACD staff. At far distance, I see Prof. Mhango, Mr. Muhoho, and others. Once again, good morning, distinguished guests, respected colleagues, dear students from TICD and our visiting students and partners from Oslo Metropolitan University, Oslo Met. It is my great pleasure and privilege to welcome you all to TICD for this important public lecture. And today's events reflects what we call growing spirit of academic operations, knowledge exchange, and global partnership that continues to shape our institutions and strengthen our shared commitment to community development. We are particularly privileged, of course, today to host Professor Helk from Oslo. Her presence here today is clear testimony to the strong collaborations between our institutions and to the value of international academic dialogue. Public lecture such as this one provide an important platform for intellectual engagement, critical reflections, and the sharing of research-based insights and address the real-world development challenge. To our academic staff and students from TICD and to our colleagues and students from Oslo Met, I encourage you to make a full use of this opportunity and let this lecture stimulate thoughtful discussions, inspire innovative ideas, and deepen our understanding of contemporary social and development issues. Academic growth strives where there is openness, curiosity, and meaningful exchange of perspectives across culture and context. As institutions committed to advancing knowledge and promoting sustainable community transformation, both at TICD and Oslo Met, recognize the partnership like this, not only ceremonial, but they are strategic and transformative, and through collaboration in teaching, research, and consultants, build capacity, we strengthen our ability to respond effectively to local and global challenges. With these few remarks, it is my pleasure and honor to officially announce that this particular public lecture is officially opened. Thank you very much for your attention.
Yes, thank you very much, Dr. Juma Mpina, our Deputy Rector, Academics, Research and Consultancy, for that welcome remark. Now we are going to proceed with our session, and maybe I should also share the format of this public lecture. We are going to have a brief question and answer session, so I encourage all of you to note down some reflections or questions of which we can discuss. After that, let me take also this opportunity to introduce our speaker of today, who is Professor Benedikte Victoria from Oslo Metropolitan University. Here is her biography. Benedikte Victoria Lindskog is an associate professor in medical anthropology at Oslo Metropolitan University, and she has 2.5 years of fieldwork experience from Mongolia, and her work includes topics related to social and ritual organizations among mobile herders, nature and environment, mobility and migration, and maternal health. She has been the co-leader in the research project, the MIPREG study, closing the gap in maternity care to migrant women in Oslo, and is currently part of a project in Tanzania entitled the Pressure Study. Pressure stands for Preventing Severe Hypertensive Adverse Events in Pregnancy and Childbirth. She has also been a senior researcher at a project based at the Australian National University entitled Mongolian Medicine, Different Modes of Multi-Species Knowledge Transmission, and from which an edited book has come forth and is now pressed with the title Mongolian Healing Knowledge, Transmission and Practice Across Inner Asia. Her research fields include medical anthropology, global health and development, and environmental studies. So it is my great honor now to welcome Professor Benedikte Victoria for this session. The floor is yours.
Thank you. Thank you very much. Okay. Good morning, everyone.
Good morning.
I'm really glad this lecture was meant for the master students. So it's meant mostly for you and, of course, our students. And, of course, you. So today I'm going to talk a bit about hermeneutics and also the goals and the means of qualitative methods. And then I will take you a bit through the different techniques that we use in qualitative methods, very briefly. And then at the end, I'm going to talk a bit about my experience from my many fieldworks in Mongolia and why they were very different fieldworks. So there are many aspects of qualitative research and methods that I cannot talk about because it's too much. So like data analysis and coding of data, as well as more other forms of techniques. So that will be left out, which I hope is fine because I only have an hour. And if I get very inspired, I might go a bit over. We'll see. Okay. So I think, I think maybe in terms of qualitative methods, I think I'll just start by telling a bit of my own academic story. So I started in anthropology at the University of Oslo, and I did a magister degree, which is quite similar to a PhD. So it's 6.5 years. And then I did a fieldwork. That was my first fieldwork as a very young student. I was 23 when I went to Mongolia. And I tell a bit about Mongolia afterwards, but Mongolia was socialist until 1990. So it was very closed, and I was actually one of the first to do a long-term fieldwork in Mongolia. And Mongolia and Tanzania actually has quite sort of, in the past, had really tight relations, because during Nyerere, it was, both were socialist countries, so I even met, in 1995, I actually met Tanzanians in Mongolia, which is a very cold country. I come from Norway, it's very cold. Mongolia is freezing, it's down to -50. So I felt really sorry for them because it's very cold. it was very cool for me. Anyway, so for the first fieldwork in anthropology, we anthropologists, we do long-term fieldwork, yeah? And that means staying in a village or with some people for at least a year. So it really is an immersion into the society you are studying and the people you're studying or studying with. So I spent 1 year with a herder family, really in nowhere land on the steppes. And they are nomads, so that we were moving from camp to camp, depending on season. And for me, you know, it was a very, very tough fieldwork. It was very cold. They live in, you know, yurts. Do you know these tents? They're round tents. And it gets down to minus 50. So it was really rough. And there was no food because it was just after socialism. And they had ration coupons in the city. So there was very little food. So I got very thin and very cold. And I didn't really know the language. So it's a very rough first experience. But I think, you know, and I stayed for a year, but I think that is the experience that really really sits here. You know, it's really in my heart. And I stayed with an old couple, and I'll show you some photos afterwards. So that was ethnography. It was like total immersion. I didn't do many interviews. I did some sort of specialist or professional interviews, but I was just living there. And getting, you know, learning about their customs and their ways of herding, etc. So then later I went to fieldwork for I'm going to talk about that later. I'll wait for that. Because what I'm going to say is actually, before going for this fieldwork, and that includes my PhD fieldwork in Mongolia as well, I had so little methods teaching. Oh, not teaching, lessons. You know, because all the anthropologists, the old-fashioned anthropologists said, you just have to go out there and experience it yourself. You will be fine. And that's because we're doing ethnography, yeah? So they thought you don't need anything. And then when I after my PhD, I moved to the medical faculty at the University of Oslo and did my postdoc. And I think you all know about postdocs. And for the our students, that is a research period of like 2 to 3 years where you only do research. And then I went into global health and maternal health. And it was really a shock because I realized that in global health, the emphasis on methods is so much more, it's much better. You know, and that's because, and I didn't operate with the term qualitative methods, I was just operating with ethnography. And for the first time I realized, you know, I really have to be meticulous in terms of my methods, especially in terms of ethics, where, you know, I'm in a project in Mwanza now at Bugando, and what I realized is that in Tanzania, ethics concerning health research is really, really good. But the drawback is that it takes almost a year to get the application approved, but it's really meticulous. And I think what I sort of learned was that within the health field, we are much more, we take methods seriously in a different way. Anthropologists, they just go out there and live the life of the locals. So that's kind of my story in that sense. And since then, I've been really thinking that we need to be really, take our methods really seriously. It's really important that it's trustworthy, that it shows validity, and that's because we are doing qualitative studies and not quantitative studies, where objectivity is more at kind of, it's easier to defend a quantitative method than to defend a qualitative method. So, yeah, I don't know if you can see, but I hope. So there is a kind of common idea that when we use quantitative methods, it's more scientific. And I see that with my master students, but to some extent also my PhD students, that they need to kind of argue for why they choose qualitative methods instead of quantitative methods, which I think personally is really unnecessary. And the thing is, there's nothing, qualitative methods are not less scientific, but it requires other kind of not techniques, but other ways of explanations and description of the methods and the steps you've taken. So it's a bit more, in order to make your research valid, you need to be really reflective, you need to be open, you need to show all the steps you've taken in your research and in the design of your project and also the analysis. In quantitative methods, which I'm not an expert at, these steps are really sort of set already, yeah? So it really requires something different, at least. And then I just also want to stress these multi-methods and mixed methods. I'm not sure if any of the master students will do that. I'm really in favor of that. I think it's a very, at least when you have a big research project, I think it's necessary. And that's because qualitative methods can kind of show something, quantitative methods show something else. And together, you can make a really strong project. And I've worked in so many multi-methods and mixed methods projects. I wanted to talk about the difference between the multi-methods and mixed methods, but I really don't have time. But I think it is about, in mixed methods project, there's a logic to the steps you take, yeah? So let's say you have one package, let's call it a package, that is quantitative, and then in time, yeah? So you have a timeline, then you have another one which is qualitative, and maybe you have another one which is like an intervention study, for example. So when you have mixed methods, these steps or these packages needs to follow each other logically, yeah? And that's mixed. When you have a multi-methods project, yeah, a bigger one, then you can have different methods running parallel. And it requires, it's a different kind of logic. And mixed methods requires much more integration of the design in a sense. Multi-methods doesn't do that. So that was kind of an introduction to the difference between quantitative and qualitative. So I know you can't read, but maybe you have it online, but this is the research process. Yeah, so it's kind of really given steps that we do. And I need to have my glasses to see my own PowerPoint, so give me a second. But, we start by reviewing, doing a literature review. We identify the problem and we ask questions, yeah? And then we also review the literature. And then we try to formulate, that's here, formulate a hypothesis. We choose a research design or methods that we want, which is the one with the glasses. Then we collect data and do the data collection and record the information. We do the analysis, we interpret the results, and then we disseminate. So it's a kind of really, in qualitative methods, it's really sort of steps we can do, but this is the reality, I'm afraid. And that's because in qualitative methods, it's very dynamic, so we go back and forth. There's no, like in quantitative methods or research, we have kind of much more given steps. In qualitative research, we have to go back and forth. It's supposed to be dynamic. And the interview guides are supposed to be dynamic as well. And they can change, and your research question can change, depending on what kind of empirical data you gather, yeah? So this is kind of the process in practice, and I think it's good to know that when you sort of go into a qualitative research study, to be aware that it is a bit messy, and it's supposed to be messy. And I think if you change during the process, it's a sign of quality rather than not being a sign of quality. It's really a sign of quality because that means you have critically evaluated your design, the steps of your design, and also the analysis of the empirical data. So, I'm afraid I will run out of time already. So I want you to have a look at this. Can you all see the PowerPoint? Maybe? So this is just about the research questions we need to have. We need to have research questions in quantitative and qualitative studies. So what you can see here is that there are kind of, this is very generic, where you look at how many has a disease. So disease is a certain disease is our focus, yeah? So what you will see here is that these are quantitative research questions. And when you move down here, you see that they are qualitative. And why? Because you focus on experience, yeah? And you focus on how people understand the disease and how the disease is kind of understood in a society. But also, we can also look at the structures that kind of shape, the prevalence and the cause and the effect and the prognosis. So, and that's why I'm saying that it's really, if you want to understand a disease, a certain disease and in all its facets, yeah, we need both qualitative and quantitative. Okay, so in qualitative studies, there are many intellectual goals. Can you see? I'm sorry, I need to move a bit, so it's okay? Yeah. So one thing that we really focus on, of course, and that's kind of a bit of a core, is the meaning. What the participants' meaning and how they, what they mean or how they interpret the events and situations and experiences or the actions and behavior that they are involved in. So it's kind of the participants' perspectives, yeah? But it's also the context. And the context is also really, really important, because all of us in this room, we are operating and behaving and relating to people in certain contexts. And the context also shapes your behavior. So you are probably a different person here than you are at home or wherever you are, yeah? So the context is always shaping, how we behave, our relations, and how we interpret. And the other thing is that we are actually looking at the process rather than the outcomes. So what we are interested in is not the outcome, is actually how we came to that point, It's the process along the way. So that's what we're interested in qualitative research. And then it's also this about identifying phenomena and how certain phenomena that we want to study, what kind of factors or elements are influencing this phenomena. And for all of you I think with the subjects you have here, that is really a core issue, I think. Because we cannot look at one phenomena in isolation. We need to look at all the factors and all the levels. And if we have a phenomena, let's say, pregnancy, among poor women in Dar es Salaam, that's really random. But, if you're not looking at the structural factors, if you're not go outside the very phenomenon of pregnancy, we are not really producing any knowledge. So that means that for all the studies we have, we need to do all kinds of levels, even up to the top level. And that means the health system, yeah? So and how the health system influences this particular phenomenon. And then also we are looking at causality. How does one thing affect another thing? But that's one thing, but in order to understand this causality, we need to interview people, because what we're interested in is not my view of causality, but is their view of how the world kind of is linked together and how things in the world links together. So here's just a list. I'm not going to go through that very in detail, but as you probably know, our goal is to have in-depth interview, because if you have in-depth interview, you will gain a lot more information than if you have a very structured yes and no questions, yeah? So we want people to tell their stories, and that's where they kind of the gold of qualitative research is. But it's also, as I said, in terms of structure, we also need to provide as holistic understanding or analysis of the phenomena we are studying. Yeah? Yes, it takes time to go through, but I want to just add another aspect, and that's comparison. And that's really at least in anthropology, is really the essence of my discipline. And that means comparing, for example, different practices in different countries, different practices within countries, but is doing comparisons. And through comparison, we produce knowledge and valuable knowledge. Yeah? Okay. Oh, yeah, it gets very small here. Okay, so what I wanted to talk about here is hermeneutics. I don't know if you know this kind of philosophical discipline, but it's kind of the scientific base for qualitative methods. Yeah, so it's a theory, and it's also used in literature studies, for example. So it's a theory about interpretation and understanding, verbal and kind of non-verbal ways of expressing oneself. But also, so it's the expressions, but it's also the context in which these expressions occur. And then, so what we, so the essence is the verbal, non-verbal communication and the contextual frameworks that influence this interpretation, and then the pre-understanding people have when interpreting, yeah? So, for example, when I study in Tanzania, in Mwanza, my background, my cultural background, my personal background, my academic background will shape my views on things. But if any one of you from Tanzania here would do the same study, maybe you would actually see something else or interpret differently. So it's really important to have in mind that our pre-understanding really also shapes how we interpret. And that's absolutely fine, but that really needs to be described and explained in the methods chapter, and very clearly. So I think, to give you an example, it says a blink and a twitch. And I'm saying that because I want you to think about contextualization and interpretation, and that we can't interpret without placing it within the context, yeah? So I don't know how it is in Tanzania, but in Norway, I can do this, yeah? And that can mean two different things. It can be I have something in my eye, or it can be that I'm flirting with someone, yeah? But in order to understand that I'm actually flirting with someone, I need to place that within the context. Do you see? So there's a difference. So context is actually very essential for understanding an act or an event or an expression, non-verbal or verbal. Okay, I'm not going to go into this, but I think I'm coming again back to this holistic understanding of the things that we are studying. Every one of you are studying one of several phenomena, but it's also, this emphasis on the holistic interpretation. So if you see this elephant here, you can't probably see, but this says it's a spear, it's a snake, that's the sort of that one. It's a fan, it's a tree, it's a wall, it's a rope. So the thing is, again, that we need to understand, all of these in order to understand the elephant. That's a metaphor, but I think it's a good metaphor because we interpret differently. But in order to sort of make sense and produce knowledge from our interpretation, we need to place that see it in this totality, yeah? Okay, so that was kind of the more sort of general overview of qualitative method or qualitative research and the methods we use. And now I want to go a bit more into detail about the techniques. And I'm sure many of you, at least our students, have been doing a methods course where they know about interviews, and I'm not sure that all the master students here also know about that. But an interview is not just an interview, okay? So interviews have many aspects, and there are many things that we really need to consider when we do an interview. And as Kvale and Brinkmann, these are Norwegians, what they say is an interview is literally an interview, yeah? So it's actually an interchange of views. And we say that because sometimes we have this idea that we are doing the interview with someone, but we are not really exchanging. But an interview is actually a good interview is a very dynamic conversation. So if you manage to make your interview into a very good conversation, well, in my eyes, then you've done a really good job, yeah? Because that's when people relax and that's when they want to talk, yeah? So they start talking about things that you were not planning, maybe, in your interview guide, and usually that is also where the kind of gold is to be found. We have many versions of interviews. You know, you can have long, short, unstructured, semi-structured, structured, in-depth. You can have life histories, which is a very good way of understanding people's kind of lives generally. And then you can have physical, you can have phone, you can have it on email, digital, and you can have focus group discussions. So there are many kind of ways of doing an interview. And so I think the most important is that we, at least that is my personal opinion, but I think we come to the point in at least social sciences where we may have to move away from this idea that we are the ones constructing knowledge towards that we are actually co-constructing knowledge with the people we are engaged with and interviewing. So that means that the ones that you are interviewing also have a voice, and that voice can also be heard. So we are actually co-constructing. So in that sense, they also have the ones are participants usually also have some ownership to some extent to that knowledge which is produced, which is my view at least. So here is, this is not about interview, but this is, he was a key informant living in the camp, and he helped me so much. He was very knowledgeable. And here we're going through a kinship chart. I made a kinship chart, and he's pointing out all the wrongs. And he was, because, you know, it's complex. So that was really helpful. And in that sense, you know, he and I stayed there for almost a year. So he and I, we actually really co-produced knowledge to the extent that he was perhaps a bit too much part of my PhD. But he was amazing. He was so knowledgeable. So yeah, I want you to kind of have that, keep that in mind that it's not the top-down thing you're doing a bottom-up, yeah? And that's why we are actually co-creating. Acknowledging, you know, other people's knowledge. Okay. I need to know how much time I have, actually. When did we start? Okay, thank you. Okay. I've already kind of talked about this, and this is something just to give you some tips. One of the basic aspects of a good interview or quality of an interview is to gain the participants' trust. If you don't get that trust, you will definitely have a bad interview. And how do we get that trust? Well, that's really hard to say. But if you are forthcoming, if you're friendly, if you start out by not really going straight to the topic, but maybe asking a bit sort of more loosely about the weather, how many children you have, do you go to school, you know, all of these kind of not very dangerous questions, not very sort of that they can feel a bit challenged by. I don't know if you yourself have been interviewed in a project, but it is a bit uncomfortable actually. I have been, and it's you feel sometimes that you want to show yourself from the best side. You want to feel that you appear as really knowledgeable, and it is a bit hard to be the one to be interviewed. And I think what we can do one of the techniques that we have is to actually kind of downplay that hierarchy. So that's what I say to all my students, is that if you want a good interview, try at least to get even as much as you can. And if you're even, the person is bound to open a much more up. And we had lots of discussions on that, especially with my students that are doctors, yeah, so they're already doctors. And when they go into an interview, they kind of want to show that they are doctors, yeah, because they are interviewing on issues that are health related, yeah. And I said, no, forget it. You know, you're a student. You're not going in there as a doctor, because once you put on that kind of metaphorically put on that doctor's coat, you know, you are up here in the hierarchy, you know, and that may have an effect on how people view, or how much people open up. So none of my medical students, at least I advise them not to flash that they are doctors. Sometimes the one you interview knows that they are doctors, then it's fine. But so that's one thing. The other thing is that, and I'm talking from a medical perspective now, is that I ask all my students not to do interviews in hospitals. And the reason for that is that the hospital is a really special setting where they've been treated, but also where all the doctors and nurses and midwives are. And they are also, at the top of the hierarchy. And that may affect how open they want to be, and if they want to talk about problems, or if they want to criticize, for example, the treatment they got. So it really is about balancing your positionality as well. And I think that is very important. But I think when you're doing a master's study or a PhD study, you are a master student. That's your identity as long as the interview lasts. Okay, so that's the interview, and I could talk very much about this and that related to interviews, but I really want to talk about participant observation a bit, not much, but that is, of course, a very central method, is to observe, and then we have kind of pure observation, which means you are going to a market, for example, and you're kind of standing at the end, and you're just watching, what's happening here, what are people doing. Or you can go to a waiting room in a hospital, etc. So that's pure observation. And then you have observational participation. And that means you can go to an event, but you're not really involved, yeah? You're going there and you may be doing the same things, but you're not really involving yourself so much. So that could be, you can be at the hospital, you can be in the classroom, for example, at the back of the class, etc. And then you have participant observation, and many of us are actually going to do that, and many of you are going to do that. And many of our students will do some participant observation, but mainly observation. But and that's where you kind of engage, like me, for my first field work and my second, and to some extent my third. You engage and you do the same activities as the ones you are living with. Usually that is over a longer period, and the prime source of evidence is your field notes, is your written notes. So you don't do necessarily any interviews, yeah? You are just engaging. And then you have complete participation, and if you do complete participation, you are moving out from science, in my view. Then you're not really doing science, because then you have become so much part of the society that you are not able to take that step away and gain some objectivity. Okay. There's one thing I want to say. So this you probably know, that you can have more unstructured, more structured, and structured observation. So you can look at that at the PowerPoint that you will have later. What I think is this balancing, is interesting, is this balancing of participation and observation. And that's really difficult, actually, because you need kind of to balance that role as an observer and as a participant, which means you have to go in and out all the time. And you need to be really conscious of that. The other thing is that you also need to balance your position as an outsider and insider. And that is a challenge, because we have this idea that if we do fieldwork in our own countries, it's going to be so much easier, and it is. But it's also very difficult, because it means that when in interviews or when we observe things, we take so much for granted. So it's not interesting. If I were to do it in Tanzania, I would see different things, yeah? And that's because I can take this outsider perspective much more easily. So when I did fieldwork in Norway, I had to really be conscious about that and not kind of delete or take out all the questions that I found as very commonsensical. Because sometimes the commonsensical is where the really good empirical data is to be found. So to be aware that when you do fieldwork in your own country, your positionality is really important, actually. And that's in a sense that so making the strange familiar may prove a lot easier than making the familiar strange. Yeah? Okay, and this is just an example. This is from Mongolia. It's a ritual that I tried really, really, really hard to be part of. So it's a homeland ritual where they offer to the spirits of the land. And I really wanted to be part of that. And it took about 2 months where the governor, the head of the monastery, and many other people were actually meeting to discuss whether I was enough a homeland daughter. And then I had been on field work before, and they concluded that, yes, she was. So I was very lucky, because it's really, foreigners are not, of course, supposed to be part of it. So I was very lucky. Anyway, so it takes a whole day. And it's first lots of rituals that takes at least, it took 4 hours, and then afterwards is archery, archery, and horse riding, the competitions, and wrestling. So it was a really, really long day and very hot. So the problem when, this was so important for me. I knew that this was like essential for my PhD research. But to take notes, to observe everything was absolutely impossible. So my husband was there, so he was in charge of this, to observe this, and I could observe that, and then we would alternate. Because one person cannot see it all. If you go to market, there's no chance that you can see everything's going on the market. So you kind of need to decide what you want to observe within the context. Okay, so shortly, I have no idea how much time I have left. Fine? Okay. So you probably know about focus group discussions. It's a very efficient way of doing kind of interviews or gathering empirical data. But it's not always very successful. It really depends on how you have composed the group. So, for example, if you are not careful and you place a young woman and her mother-in-law, for example, it might be that the young woman will not speak freely. So then I would have a focus group with only young women. I would have a focus group with mother-in-laws. If you place, for example, a nurse and head doctors in one focus group together, your hierarchy comes in. And if you want to focus on, for example, barriers, problems, issues that are problematic, I can guarantee you there will be no discussion because the younger ones, women, the ones in the lowest in the work hierarchy will not be able to talk freely. And that's how it is. We live in hierarchies, all of us. So we have to accommodate for that. But it's very efficient if you want to have lots of empirical data very shortly, because interviews are really time-consuming, but they are more successful, but these are more efficient in a sense. And it really depends. One thing is the composition, but it's also the questions you ask, yeah? So you need to have good questions that makes the people in the group interested, There's something they really want to discuss or quarrel. Maybe they start quarreling about something, but at least you really need to think about the questions you want to ask. Okay. So we're moving a bit away from techniques, and there are other techniques, but I can't cover it now. But we're moving into reflexivity. And in quantitative study, you don't really need to reflect so much. You follow the steps that you have to do. And that could be in a quantitative questionnaire or register studies, etc. But in qualitative studies, reflexivity is essential, and it's essential to, in order to have a good design, but also for the performance of your research, but also in terms of analyzing your data. So you also need to be reflexive in terms of that. And that really needs to be described in your methods. And sometimes people say, well, it's not really scientific. If I put myself in the methods chapter and I say, well, it is, because the more detailed you are about how you experienced, how you coped, you know, if you had any challenges, how did you deal with it? You know, the more detailed you are, the more trustworthy you are, yeah? And that's the thing, we are dependent in qualitative research on trustworthiness, you know? We can't be 100% objective. We can't prove validity as you can in quantitative study, but we can at least, you know, through description, through reflexivity, provide trustworthiness to our studies. Sorry. Okay, so again, I'm coming a bit back to this reflexivity bit. So we have this tendency to think of ourselves when we do scientific research that we are more or less objective, even in quantitative studies. But other research has actually shown that where we stand politically, ideologically, you know, in terms of religion, might actually also have an effect on the choices we make in the design, but also maybe when we are doing or collecting data material and when we analyze our data material. And that's something, and that's fine, you know, because in qualitative methods, that is fine. But you just have to describe really well and reflect on the fact that, let's say you are interviewing someone, a Muslim population in Zanzibar, yeah? And you are yourself Christian and you're looking into religion. Well, if you don't reflect on your own, where you come from in terms of faith, then, you know, then I would, if I were your examiner, I would wonder, why haven't you reflected on that? Because that may have an effect. I'm not saying it has an effect on how you interview or you know, your data material, but it may have an effect. And be open about that. I think it's really important. So I think we're just going to go a bit further. I will leave this now because in terms of time, but we talk about epistemological reflexivity, and that's kind of reflecting more about your project as such. You know, how are the research questions defined or limited? That which can be found, you know, in terms of what you're looking at. How can your research questions have been studied in a different way? Just reflecting about that. It doesn't have to be written down, but just reflecting. But there's one point here which I think is really important, and that is, you know, in order to produce knowledge, we have to use language, and we have to use words and concepts, and we have a tendency to not defining them properly. I mean, many students have that. And I think, you know, it's really important if you use a word like culture, power, you know, sustainability, community, I think it's a very good idea that you actually describe or define what you actually mean by these concepts. And that's, and I'm saying that because, and that's in terms of reflexivity, but also the positionality, that we interpret the world differently, and we put different meaning into different concepts, yeah? Into similar concepts. So it's important to have in mind that some words may give different associations in different cultures or subcultures, and to be aware of the words we use and the terms we use, and actually make an effort to be honest about how we understand and describe them. Okay, and then it's personal reflexivity, which I have actually talked much about now. So, but it's still this idea that we are so objective as researchers when we are actually not. Because what we see, for example, in Norway is that we have a not right wing, but kind of right side in politics, and we have a left side in politics. And then they've done research on how researchers evaluate conclusions made, like fictive, is hypothetical. So the ones that have conclusions that kind of align more with the left-wing ideology and views are given higher score if, you know, the left-wing researchers are evaluating. Do you see my point here? Yeah. But we have this idea that when you evaluate, like an application or whatever, that we are neutral, that we are scientific and objective, but very often how we stand, for example, politically or ideologically, can actually affect what we produce or how we evaluate. So having that in mind is also something, at least I think, is important. Okay. I'm leaving this. This is our kind of ways of reducing bias, and I think, you know, in qualitative research, there's a danger of bias all the time. But bias is not necessarily something wrong. It is wrong if you don't describe it. So if you don't describe your own biases, well, it's not wrong, but then, you know, I think that's problematic. So, and that may also, so if you want to think about it being scientific, it's all about describing in detail. Okay. So now we're going to validity and trustworthiness. And again, you know, I kind of have been talking a bit, but I want you to have a look at this. You know, some of you will see 3, some of you will see 4. And that's the thing, you know, all of you in this room, we interpret the world differently. I mean, we interpret it quite much the same. For you Tanzanians, you have some cultural background that makes it, so you interpret kind of the same, but you also interpret individually, and it's the same for the Norwegians here. So, of course, you know, where we come from, our background has an effect. But I think that is really important to have in mind, that we do see the world in different ways, and not in the sense that they're not compatible, but we do have, how we have lived our lives do shape us. Very shortly, so this is like quantitative research, and these, for the quantitative people here, you probably know this, you know, you need internal validity, you need external validity, objectivity, reliability, and all of these are words that are very scientific and that we like. When we move over to qualitative studies, you know, we're talking about transferability. Can the results of your project, can the methods you've done, can they be transferred to another context, another country? And we also think about credibility, and that is about reflexivity, that you actually, can I trust that you have collected data and not invented it? Can I trust that you have reflected on how you've gone about doing your research? And then we have confirmability, and that is that you are actually representing the ones you have interviewed in a good way, in a correct way. So it's not against what they actually said or what they actually believe. So, and of course, reflexivity. Okay, and when we have kind of some strategies in qualitative research, so we can work towards receiving or making our studies valid or trustworthy. So one is triangulation, and that's very much used, of course, and that means you're using different kinds of methods to look at one phenomenon. And that can also be kind of peer review. So in some research, what they do is they send their transcriptions to the people they've interviewed for them to comment, or they invite them in to be a co-partner in the research. So that's one way of also creating triangulation. And then we have prolonged engagement, which is what I did for my first field work. You just stay long enough so you have enough knowledge to say or to write what you want to write, and to develop this kind of understanding of the context. And there's thick description, which is also very important, and that is describing thickly and widely and in detail the context that you are doing research on. And member check, and that's what I talked about in terms of asking peers to discuss with you or to correct statements, etc. So kind of summing up here. So these are the kind of the 4 T's for creating trustworthiness or / validity. So it's trust and time, that you have enough time, triangulation, thick description, and transparency. Okay, I'm coming towards the end. So now it's 11. So this is Mongolia. like my mother-in-law, she couldn't place Mongolia on the map. Many can't place Mongolia on the map. It's a country no one knows about, and it's huge. It's 3.5 million now, I think, and it's a country 5 times the size of France. It's massive. So, and you can also see that it's kind of sandwiched between Russia and China. So this is the country that I stayed in. So it was 70 years, it was a socialist country for 70 years. In 1990, it fell apart and it became very much privatized. And talking about structural adjustments, as you probably know about, that happened there as well. And it didn't go so well, I have to say. So Mongolia had lots of minerals, lots of gold. So they had the opportunity to actually do something, be wealthy. And then, you know, lots of things came in, but corruption, one of them. So unfortunately, they have gone from all the people in Mongolia having something to someone having much and many having nothing. So it's a bit sort of sad picture, especially for Mongolia. At least it saddens me, but yeah. So this is the camp. This is the spring camp, actually, where I lived with these guys. So these, I stayed for 1 year, and this became my, how do you say in Tanzania about my dada? Oh no, my grandma and grandpa? Yeah. Yeah, so grandpa and grandma. So they were my grandpa and grandma. I was their daughter, so it was a bit of a crash in terms of titles. But so I stayed with them for a whole year, and we moved from place to place. And it was, as I said in the beginning, it was a very, very rough fieldwork for a very young and very skinny student. And I missed home so much. And I was in the middle of the steppes, so there was nowhere to go. So the only way to get somewhere was to ride. And I couldn't just take a horse. And I was not allowed to walk outside the camp because of dogs and wolves and horses and men, and I don't know. She was really terrified that something would happen to me. But I think what I want to kind of tell about this fieldwork is that for me, that is the fieldwork, as I said, that really sort of changed me and really sort of makes my heart beat when I think about it. And that's where my closest relations were established and where I really gained most knowledge. And I say most knowledge in the sense that I really learned about Mongolia and Mongolian culture and life and rituals and rules, the many, many rules for how to sit, how to move, how to cook, you know, and everything. But so it was a really sort of intense but very different fieldwork. And then this is the next fieldwork. And then this is in 2003. And then I got my first daughter. She was 5. So we went, my husband and my daughter and I, and lived in the tent. I think I have a picture. So we lived here in this tent. This is a... Oh, I was going to say it in Swahili. Ndungum. Yeah, it's a mare. So this goat, I love goats. I don't know. So... Yeah, so we lived in this tent, and it was a very different fieldwork because this time I wanted to have a bit more comfort. So we actually had our own tent as a family, and we even bought a car so that I could be mobile because that was the worst thing of not being able to go anywhere. So we had a car. This was a very sort of structured, with really clear aims fieldwork. So I would drive out and interview herders in the area and do interviews, yeah? And it would be proper interviews, in depth, of course, but proper interviews. And also, this was a fieldwork where I really had a more plan, a better design, and it was I was very conscious about what kind of material I wanted to get. So it was really different. It was a good fieldwork, but very different in terms of research. And then this is, I'm just showing you, this is one of the aspects I looked at, was these winter calamities. But let's go to next. And then I went for my postdoc, and then I wanted to look at migration because almost half of the population in Mongolia have migrated from the city, no, from the rural areas to the city because of many, many aspects, which I won't talk about now, but part of that are the winter calamities. So we're seeing tremendous migration. So now in Ulaanbaatar, about 70 to 80% of the people living in the main capital, Ulaanbaatar, are former herders, and they take their tent, and they live in these suburbs. And as you can see, Mongolia is now the most polluted capital in the city in the wintertime. So there's lots and lots of health challenges. But anyway, so what I was looking at was these migrant women and their access to health services when pregnant in the capital. And again, you know, after having sort of lived in Mongolia for almost 2 years, I've done field work, I felt really I had the knowledge. I didn't feel the need to live in the countryside because it's strenuous, yeah, especially, and then I had 3 kids, so, and they came with me, but we couldn't live, you know, for a year in a tent. It was a bit too much. So again, this was a field work where I was really strategic, and I just went for the things I wanted and what I needed, and I did very sort of structured interviews, and I knew what kind of data material I wanted. So I went from the first field works, like ethnography, to less, a bit more structured to very structured. So there are many, many different ways of doing qualitative research. And as I've shown you, you know, these are one of them. So I think I had to stop. Asante sana.
Yes, thank you very much, Professor Benedikte, for very insightful lecture. We have also have a very good experience. We have had a very good experience, your experience on qualitative studies. We thank you very much for that. Now we are going to have another session. We are going to have a question and answer session. So if you have questions, I can give you an opportunity to ask, then Professor Benedikte will react to that. We are going to take a few questions because we don't have much time. So we are starting with Dr. Lukumai. Yes.
Thank you very much, Professor Benedikte. Mine is, first of all, to congratulate you for the very good presentation. But I have a question. When you have just started, you have introduced with us, especially on the process, and there was that picture of a zigzag.
Oh, you mean the chaos?
Yes, and I just wanted to know that how do you go about that? Because to me, it's like, I wanted to know, how do you formulate the research questions? And how do you come out with the research questions which you have formulated? And the zigzag.
Yeah, yeah. It's a good question.
To go out with.
Yeah.
So that is the thing which I really wanted to know. But again, the way you have presented, it's like it's someone who is doing the longitudinal study.
Sometimes.
You have stayed for quite long, and now you have the research questions which is guiding you. To gather the information that you want to gather from the participants. But again, there is this issue of participation, and I'm wondering, I wanted to know that how long you set the time of interviewing your participants. Thank you.
Okay, so we'll take the sort of chaos. You know, we can't sort of set out with chaos. We need order, yeah? So we always design a project and so that it has really given steps. And the given steps are really important for us to actually, so that the project in itself is integrated. All the parts of your project should be integrated and be logical and be good, yeah? But I think sometimes what happens is that when we start doing our research, we realize that we have to go back and change maybe the research question. We have to go back and maybe change the methods. And maybe we need to change our interview guide because the questions, they don't work, yeah? So that's what I mean by the research process in practice, because we are going back and forth and back and forth. And if we aren't dynamic in that sense, we are going to have not a strong research design and research project. So being dynamic and not being afraid of changing things, I think it's really relevant. So that was the one question, and the other one was interviews. I think I've done many other research projects as well, and sometimes you do in a qualitative study, like in medical research, you do 20 to 40 interviews maybe, and they're maybe 1.5, 1 hour, half an hour. Some interviews are really good, some interviews are not so good. But I do not do the longitudinal studies anymore. Because, life comes in the way and you have a family and it's hard to go away for a whole year. And I have a dog. Yeah. So I think it really depends on the project. So the project in Apugandu or Kuhas in Mwanza, I only supervise there, but then we have a qualitative study which is also really structured, yeah? It's really sort of work packages, and we do this and do that, and we have to kind of do this and do that because it's a big project with a really, really big quantitative study, yeah? So, but I think being flexible, or knowing that maybe the process itself will maybe not turn out the way you anticipated. It's a good start because it's not a sign of weakness, it's a sign of quality, in my view. Yeah. Yeah.
Yes, thank you very much. Can we have another question? Yes, welcome, Professor Mhango.
Thank you for giving me an opportunity to ask. Mine is that if I was to be asked that to choose between the quantitative and quantitative, I could opt for quantitative because of the decision.
Yeah,
yes.
I do see that.
How easy or difficult it is when it comes to analysis, because you have words or statements or narrations.
It's a good question. I mean, I'm not a quantitative person. I think most of you here are probably better than me because I've been doing qualitative. I know quantitative to a certain extent, but I'm not an expert. But I think, when you do, I don't know what kind of quantitative analysis you do, but yeah, it is a bit simpler. I have to admit. It is a bit simpler because there are really sort of given steps you follow. But the thing about qualitative is that, I have to say, and that's very personal, it's very meaningful, yeah? And now with the technology we have, you can have transcription programs that helps you to transcribe, so things are much easier. So, but the main job is to analyze. So when you collected all your data, you need to code all your material, and you need to analyze the material. And there are many different ways of doing that, and that can be thematic analysis, you can, many different, I'm not going to go into that, but anyway, you can do it also in vivo, for example, or hypertranscribe. So there are many sort of tools that we can use, but still, it takes time. But it's very meaningful. It does. But I think in quantitative studies, especially if you work on register studies, it takes at least 2 years, at least in Norway, or 1 year to retrieve all the data material. And also, if you do a questionnaire, it takes time to go through. So time-wise, I don't know. Well, you tell me, because you're probably the expert in quantitative, but I think time is not really relevant, I guess, if you're really engaged in what you are doing. And all my students that do a qualitative study, they are as much on time in handing in as the quantitative ones. Often even more. So, yeah. Was that the answer?
Yes, but
sort of.
Sometimes when it comes to conducting like content analysis, there is somewhere where you use quantitative part of it, where you can count codes or some ideas as to how many or how much they appears in the mentioning. So I don't know.
Yeah.
Can you conduct that quantitative part of quantitative?
Well, it depends on what kind of. I don't think. I think using quantitative tools to analyze qualitative material, I think that kind of does not give credit to what the qualitative research actually is, in my view, because then it becomes kind of semi-qualitative. And for me, then you can do a quantitative questionnaire instead, in my view. But again, that's personal, and I'm an anthropologist, so I come from a different place, I guess. So, but it's my personal view, at least. But I think, they're both valuable, and I think there are ways of mixing. But I think, and also in the analysis. But in terms of the sort of analyzing your empirical data material, that needs to be done in a way where you appreciate, the value that is in the material. And then qualitative analysis methods is better, I think, in my view. Yeah. Yeah.
Yes, thank you very much. We can take another 3 questions.
Oh, okay.
Yes. Someone?
It's okay.
Let me welcome Dr. Hina, then Dr. Lumai.
Thank you very much, Prof. Benedikte, for a very comprehensive presentation. We know we have quantitative and the qualitative. And some scholars believe that the findings presented in quantitative way are better off.
Yeah.
Those that have been presented using qualitative approach. What is your stand on those views?
Ooh, yeah, that's a big question. Well, I've worked in projects like the one on the newly arrived migrants to Oslo, and that was a huge project when we applied money for, and it had 2 work packages, that were quantitative. And then you can ask about the value. I mean, I do see the value of big data, or I do see the value of quantitative numbers, We need them. It's really necessary, and it's fantastic research. But it doesn't really help us if we don't have the qualitative component as well. So let's think about, we want to do a development intervention, and then we want to evaluate that intervention, and maybe we want to evaluate that intervention with quantitative tools, But the problem is that in order to make success with your development project, you need to talk to the people first, because if you don't talk to them, they might never use, whatever they are introduced to, because they don't like it, because it's not their cultural practice. We have so many examples, especially, from our NORAD, Norwegian, help me now. Aid organization that has had many projects in Tanzania, in fact, and some of them have been complete failures, and they have been failures exactly because they have not asked the people, what do they need, what are your practices, how can, will you continue using this tool? And it's the same. I came to Mongolia in its really tiny medical clinic, And they came to me and they said, we got this machine from Germany to analyze, I think it was insulin or something. It was a big machine. And they said, but we don't know how to use it. So I've been standing there for like 5 years. It was all in German, and they wanted me to translate. I don't know German. I couldn't help them. But, you know, it's kind of, if we want something to be successful, you know, we need to start from bottom up. And a way of starting from bottom up is to do a proper qualitative study, not 3 weeks, not just an assessment, but really get to know people and their thoughts about, you know, this intervention. And I think, you know, very often I've felt that myself, especially in global health and in projects I've been part of, that I just become the qualitative alibi, yeah? Because you get money, you get funded if it's multidisciplinary, so you bring in a qualitative person, but you're not really, you know, it's the alibi. So I felt that myself. But I think, you know, there's more value to qualitative research than that. And I think it's on time that we get to the point where we actually see qualitative research as science and as an important research, because we need this knowledge, especially in the world we're living in now. We need people's opinion. We need to hear people's voices, you know, what they want, and especially within development studies, you know, or development projects. So I'm very much in favor of quantitative research, but I'm even a bit more in favor of qualitative, if I can say, yeah.
Yes, I think I should give this opportunity to, because you have already shared your question. Let me give this opportunity to Mr. Coco, then Mr. Wambu.
Good morning, everyone.
Good morning.
Good morning. Yeah, thank you very much for the opportunity and the presentation that you have just made to us. Just a word of appreciation. Thank you very much for the wisdom enhancing presentation on how to organize and become very careful in how we manage, especially the quantitative research projects. In my understanding, what I've captured in this entire presentation, I wanted us to get back to how we organize our researchers, both quantitative and qualitative. We wanted to say also that both the quantitative and the qualitative are equally important, and also we wanted us to understand that they can always be meaningful if we behave well, if we, what should I say, if we develop enough competence on how to organize both two quantitative research projects and qualitative projects. We wanted also, under the philosophy and the wisdom of Albert Einstein, wanted to tell us that it takes the optimization wisdom on how to produce meaningful qualitative or quantitative. So therefore, my conclusion could be that both the quantitative and the qualitative have equal importance, and they can produce nonsense or sense products, as long incompetence or competence does influence the process of the matter. This is what I have understood. And today, I appreciated the role and the significance of qualitative research. As long the research takes the right position and the respondent takes the right position and the process system is well organized and managed, objective, the concept of objectivity and the holistic organization and management. So this is what I wanted to say. So I think I would love to draw attention of this audience to the wisdom produced by the Albert Einstein.
Yes.
Not everything that counts can be counted. Not everything can be done.
Counts that can be counted. Yeah.
Can you go back to the first slide? The first slide.
Okay. Give me a second.
Albert Einstein wisdom. Not everything that can be counted counts. I think we underline this statement.
Yeah.
Not everything that is quantitatively
Yeah.
produced can be quantitatively
Yeah.
wise.
Yeah.
Okay? And then not everything that counts can be counted. So this is very necessary to understand for both the quantitative, pro-quantitative researchers and pro-qualitative researchers.
That one is very,
it
encapsulates. Yeah.
Thank you.
Thank you for words of wisdom. Very good. Yeah. Here. Yeah.
I think we can now proceed with the session.
We have one.
And also, after Mr. Wambura, we will.
This one here as well.
Yeah,
thank you, Madam Chair. My name is Daniel Wambura. We are working here with KCD as a lecturer. I want to thank you for the presentations, the nice presentation. We have shared a good experience. But one observation that after the long observation or interview discussions, we need to sit down and analyze issues, analyze different issues. So I want you to help me to understand. At the end, normally we have content, and we have to analyze content by using the content analysis or thematic analysis. How best I can move in order to take a step to make that analysis. Thank you.
Yeah, thank you. Oh, yeah. I mean, there are many ways of doing that, and I think, the most simplest way that I urge my students to do, even my PhD students, is actually thematic analysis. And I say that because it's a way where you can actually engage really well with your material. So you have to reread maybe 10 times all your own transcriptions, and you code it into themes and sub-themes, and you work with your themes and sub-themes to make, maybe 4, 5, 6 really good conceptual main themes. So in my view, that's the best. So I'm not really the one to evaluate, but for me that is really compatible with qualitative studies. It gives kind of justice to the data material you have. So yeah, does it answer? No, maybe? No. Ask me more if I answered it, but.
Maybe I wanted to understand during the conversation, the interview or this discussion, how best you can move and understand that at the end of the day, I need to analyze my conversations.
Okay, interviews.
Content analysis of the thematic analysis, and when I go for thematic analysis, how best I can guide the participant to give me valid information that will lead me to take that to analyze.
Oh, okay. So when I talk about thematic analysis, I usually talk about it when all your data material has been gathered. So it's sort of you finished all of your fieldwork, and then you sit down and you do this tedious work of analysis, which is the most important part. But of course, at the end of the day, you've done an interview, you've done a focus group, then I always urge my students to sit down and kind of analyze for themselves what happened today, and look, maybe if they have time to listen to the transcript and kind of make an abstract for each day that you have been working on your fieldwork. I'm not answering your question, am I? Is it okay? Yeah. So I think, and I think it's really important not to start analyzing before you gather all the material, because the point of analysis is actually to see the links, to compare, because you ask the same question, maybe to 20, 40, or 10 people, and you want to compare, You want to see, do they sort of answer differently to this question, and if they do, what's interesting about that, So, in my view, I think it's important to do analysis underway, but it's more reflections, and then you do the bulk of the analysis when you're at the end. At least that's how I do it. There are many ways of doing qualitative studies, so it's just one way. Yeah.
Yes, thank you. Now we are welcoming Professor George Kenyashi.
Thank you, Professor, for the presentation. And I now got a new definition of interview, which is, I think is interesting to us at the School of Community Development. You are saying interview is exchange of ideas. And for us, we are, at the School of Community Development, we are interested in people-centered. So we really need to, I think, my colleagues, to get to know this method of qualitative analysis. Because this is how we engage people. So I think we need to increase our competence in this area. I had these questions, which one between quantitative and the qualitative should we go for?
Yeah.
Yes, we can have a balance of the two, but as a School of Community Development, I think we need to be more competent to talk to people and get to the idea like the anthropologist does. I have a question on observation.
Observation, yeah.
I used to know the non-participant and participant observation. Today you added to me the complete participation.
Yeah.
If you go to complete participation, you are out of science.
Well, in my view, but...
How do you balance? How do you draw the line between the participant and
well, it's just... It's a good question. I think it's more a way of phrasing that when you have full participation, it's just you are kind of on the edge of you are so much involved that you're not thinking science anymore. Yeah, and it's important to think that we're not. I mean, we also in qualitative methods we do seek objectivity. It's not something that we sort of shy away from. So objectivity is also a goal, but we just have to realize that we cannot be 100% objective. So we have to just kind of give it up. But full participation, then objectivity is at risk, I think. And I think when you are so involved that you're not really doing research anymore, then it is not research, in my view. But what I wanted to address that you said first, I think. In this project that we applied for at the Proffesor in Monza, so that's a co-creation project. We applied on basis of equal partnership. So it's half Tanzanian, half Norwegian, and some Netherlands as well. But an important aspect of that project is actually co-creation, which means we have established a patient organization, and they are running themselves now. And they are the ones that give feedback to us. So they go through our interview guides, they go through everything we do, actually, and give us advice, because they are the former patients. They have the knowledge of preeclampsia. Yeah? So this co-creation is coming more and more into science. And in my view, that is the best way of doing it, and it's also the best way of doing it also especially within medicine. Because we do have this need to decolonize medicine, and I think that is a really good way of doing it. And also, so it's this equal partnership, but also co-creation, so that we don't get this global health that we have Western scientists coming into global South and just extracting knowledge and then leaving and. That's it. So by sort of emphasizing co-creation, we have a potential to kind of improve, or not improve, but to give access to, like my PhD students. He's a head doctor. He's doing PhD now. He's a wonderful, and he's doing qualitative studies, which going from quantitative to qualitative is a challenge. It was really challenging for him to think in that way, because he's right. he's a medical doctor, is like this. But I think this is a really, it provides opportunities, but it also provides equal production of knowledge. Yeah. So in that sense, but that wasn't really. But I think at least a co-creation, and that we, at one point, probably need to realize that we don't, as scientists say, we don't own knowledge. That knowledge is also owned by someone else, and that are the participants. But again, I have to say this is my personal view. So, but I think that is the way forward to do good science, especially within qualitative studies. Yeah.
Yes,
thank you
very much. We appreciate, and I'm sure that we had a very interactive session whereby we shared the experience from you and also from Professor Benedikte. So after this session, I would like to give this opportunity to Dr. Anande Kwevka to give us a note of thanks and also to officially close our session.
Thank you.
I
want to declare that I am also a believer of qualitative.
Yes.
So I join her. Okay, on behalf of participants, I would like to extend our appreciation to our speaker. However, in relation to the vision of our institute, we like to appreciate the way you have emphasized on listening, understanding the context, and also building relationship, which reminds us that development is not imposed. It is also facilitated through collaboration with the community. Also, your presentation has also strengthened our understanding that qualitative research is not an academic requirement only, but also a vital tool for effective community development practices, of which now is what we are emphasizing as an institution and is what we are teaching our students. We appreciate for your time and also for sharing your expertise with us. Thank you and welcome again.
Thank you. As our session is already closed, I think we can proceed with our activities.
Yeah, so Madam Chair, can we have a request? Can we have a group picture maybe with the guests for memories?
Yes, that is also we are going to do it outside.
Okay.
The presentation will be shared later. To